Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Neck dissection and types. So first we are going to look at the dissection and then the lymph node removed and the structures removed. So first is the RND. The RND is the radical neck dissection. So the lymph node removed is 1 to 5 and the other structures which are removed, it includes the CN11, IJV as well as the SCM. So these are nothing but it is removed. Next comes the MRND. MRND is the modified radical neck dissection. So MRND, it is lymph node removed is 1 to 5 and here the structures removed are CN11 is preserved. So CN11 is preserved. Next is the MRND 2. So MRND, the lymph node removed is 1 to 5 and here it is a CN11 and the IJV, if you see, it is preserved. Next is the MRND. This is 3. So MRND 3 involves again 1 to 5 lymph nodes. So here what is preserved is the CN11. So CN11 IJV was in grade 2. Now it is also the SCM is preserved. Next is when we look at the END. So under the END it is again 1 and 5 and here it is the CN11, the IJV, let's write it neat. So it includes the CN11, there is the IJV, there is SCM, so they are nothing but it is removed and plus 1. Next is there are more lymph node groups, there are presence of more lymph node groups and there is a non-lymphatic structures. Next, let's look at some selective neck dissections, SNDs. So in terms of the supraomohyoid, the supraomohyoid, so here the lymph node removed is 1 to 3 and the primary oral cancer is nothing but the oral cavity. Then we look at the extended supraomohyoid, the extended supraomohyoid. So extended supraomohyoid, this includes the lymph node that is 1 to 4 and the primary site of cancer here is the oral cavity as well as the oropharynx. Then comes the posterolateral. The posterolateral is 2 to 5 and the primary site of cancer is the skin over the posterior scalp. So it is the skin over the posterior scalp and also the upper neck. Then when you look at lateral, this is the 2 to 4 lymph nodes and it involves the oropharynx, the hypopharynx as well as the larynx. Lastly, we move on to the anterior. The anterior or the central. So here in the anterior or the central, the lymph node is involved, is the 6th lymph node and the primary site of tumor is the thyroid. It's the thyroid as well as the midline structures. To learn and grow daily like this, please do subscribe.